Welcome to today's edition of Mental Health Matters. Today, we're going to be talking about the adverse childhood experience along with the LGBTQ community. I have Pashi and Amanda on the show, and they're going to give us some tips and educate us on ACEs. Pashi, Amanda, welcome to the show. Oh, wasn't that an introduction? So, how are you two doing today?
I'm doing great. I'm very excited to be here. Thank you so much, Jesse, for giving us this opportunity to be on the show.
Absolutely. So why don't we start by you two just introducing yourselves and just kind of talk a little bit about your background, what you do, and then we'll just go from there.
I'll go ahead and start just so we don't do the dance. So my name is Pashi Walker. My pronouns are ZZ or Zers. I'm actually the LGBTQ program director for Cal Voices. And I'm also the project director for the ACEs Aware initiative project that we're going to be talking about today. I have been working on LGBTQ disparities and mental health and well-being for the last 13 years. And I have worked with Amanda and the California LGBTQ Health and Human Services Network and the Health Access Foundation for quite a few years now. And I'll just hand it over to Amanda now.
Nice, Pashi, nice.
Great, yeah, and hello, my name is Amanda McAllister-Wallner. I use she, her, hers pronouns, and I am the director of the California LGBTQ Health and Human Services Network. We're a project of Health Access Foundation, and we work to address LGBTQ health disparities throughout California through our statewide projects, Out for Mental Health and We Breathe, and by advocating for policies and systems changes throughout the state and at the local level as well.
Okay, wow, very, very impressive. I know we have our set questions, but I want to ask you to, what made you want to get off in the line of work doing what you do? Because in my opinion, it's great work. I think advocacy and education is definitely needed for the LGBTQ community. So I want to know, like, what made you to just, decide to just go full force in what you're doing in your respective roles?
I'll go ahead and go first. Just that just makes it easier. So I'm going to try and make a very long story short. I actually came out as lesbian, queer, as an older adult in life after the age of 40. And at that point is when I went to get my social work degree. And I experienced a lot of adverse childhood experiences that we're going to be talking about, along with the rejecting behaviors that we'll also be discussing today. And I just didn't want anyone else to follow in those footsteps. I didn't want anyone else to have to hide who they are because they feel they either didn't know or couldn't come out. And so I had to lead like this empty life, not that the life was empty, but had to lead a life where they weren't including a whole big piece of who they were. And as I got into the work, I began to realize that I could go into clinical work and help one person at a time, or I could do what I've ended up doing, which is go into policy, legislation, and other types of bigger projects and help lots of people at a time when what's causing the disparities isn't what's inside the person, but what's happening on the outside of the person. So sometimes what we call social determinants of health and mental health, but I think that's a short answer of what led me here, and I'll pass it on to Amanda.
Sure. Yeah. Thanks, Pashi. I actually came to a lot of this work through starting out being very engaged in politics. Prop 8 passed while I was in college, and I was a campus organizer for the No on Prop 8 campaign, and worked for a number of elected officials and candidates. But I knew that where, I really wanted to make an impact was working on issues that impact my community, and have been volunteering on LGBTQ campaigns and issues for a pretty long time now. And when I went to grad school, I got my master's in public policy. I really wanted to get more invested in health policy, because every issue that I care about is a health issue, whether it's the lived environment and walkability of neighborhoods, whether it's what's happening in our schools. All of those things impact our health and well-being. And I know that our LGBTQ communities are disproportionately impacted by a number of health challenges, and really wanted to do what I could to make a difference in the lives of LGBTQ folks, and work toward policies that will improve our health and well-being, and allow LGBTQ people to really thrive, and not just get by, but really thrive and live our best lives.
I really, 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 really genuinely adore and respect what the both of you are doing, because I think it's very, very important. I've been doing this show since 2015, and since I've been doing it, we've only had maybe two. I want to say this is like maybe the third show that we've had pertaining to the LGBTQ community. I feel like we need to be doing more shows on this. We need to be bringing out more education, because it's a lot of education that needs to be geared towards this community. And the reason why I wanted you guys to kind of talk about why you got into this particular work that you do, because I want people that watch this show to be able to know that you guys have deep, deep, deep passion for what you do. Also, if there are other people that identify with the community, that they can be encouraged and go forth and do the same work as well. I personally think that's very important. So thank the both of you, seriously. All right, let's go. We're going to get into these questions. All right, for those who do not know, can you briefly explain what ACEs are and why screening for them is so important?
Okay, and let me share my screen to answer that question, just to help. And let's see, why is it, what am I doing? This is the part that I'm like, there we go. While I'm looking for my screen, and of course it's going to share the wrong PowerPoint. Okay, of course. Okay. Are you seeing a PowerPoint in front of you that says ACEs aware before I put it into a slideshow?
It says family acceptance.
Family acceptance.
Oh my goodness. Okay.
That's all right. This is organic. This is
organic. So while I'm struggling with this, and this was the thing that I was most afraid would happen, I do want to put in a plug. If there is anybody who wants to get involved in policy, legislation, advocacy work, because I agree with Amanda, everything really does pertain to mental health and well-being.
Yes, absolutely.
We have an Out for Mental Health project that has opportunities to do local work across the state. So please get in touch with us, and we would love to help you get started in your work. Let me just quickly tell you what ACEs are. ACEs stands for Adverse Childhood Experiences. And it didn't start with the, this first slide. So in California, we are very fortunate. We have an ACEs Aware initiative that's been funded by the California government. And the purpose of it is to help providers understand how important it is to screen for adverse childhood experiences and to help train them to respond in a way that actually will be helpful to the person that they're working with. So just really briefly, adverse childhood experiences, or ACEs, are really stressful or traumatic experiences that a person might have before the age of 18. There was a study done in 1998 by the Centers for Disease Control, otherwise known as the CDC, that we've all been hearing about, and Kaiser Permanente. And they found 10, or they identified in this study, 10 categories of adversity, of adverse experiences. And they put them into 3 basic, what they call domains. So abuse, neglect, and household dysfunction. And I'm going to show you a little bit more about that in the next slide. So I don't know if you can read this very well, but I just want you to have an idea of what's going on, because later we're going to tell you, for LGBTQ folks, not only how we fit into this, these dynamics, but also where some of the trauma that we experience as children don't get screened for using the ACEs screening. So we all understand abuse, I think, when we're talking about physical abuse, emotional abuse, and then any kind of sexual trauma. There can also be neglect that's either physical or emotional. And then there's challenges that people might have during their childhood with what's happening in the home with their parents or their caregivers, and that, like, mental illness or intimate partner violence. Their parents might get separated or divorced. That is one of, and that happens to like half the kids, or their one or more parents might be incarcerated, and there might also be substance abuse. And I know I'm going through this quickly, but hopefully if you have any questions, you can always Google ACEs Aware and get more explanation. One of the things that they found, so we tend to focus on mental health at Cal Voices, but it's really interesting that they found that people who have a lot of ACEs in their background also therefore have a lot of risk for their health, and that ACEs increases the risk for at least 9 of the 10 leading causes of death in the US. And Amanda's going to talk a little bit more about what happens if you have a lot of ACEs. But I just want to show number 10, suicide attempts. It increases your risk of having a suicide attempt by almost 38%. So that's or 38 times, I'm sorry. So that if you have 4 or more ACEs, so that's a pretty big number. And this is why we're trying so hard to get people to understand what they are and to screen for them. And then what we try to tell providers is that if they're screening for ACEs with their children, their child patients, their youth patients, or even their young adult or adult patients, that if they screen for that, if they check for what's known as toxic stress. So we all have heard the term stress, but toxic stress is really, really bad stress. And if they provide what we call evidence-based services, in other words, services that are proven to work when you have this type of trauma, it can greatly improve the health and well-being of individuals and their families, and also really reduce the risk of some of the things that Amanda's going to talk about. The other thing we want providers to know, if any of you are out there watching this and you weren't already aware of this, that the ACEs Aware Initiative will offer Medi-Cal providers training, screening tools, protocols, and payment for screening children and adults for ACEs. And finally, I forgot to mention this right at the front because I was having trouble getting my PowerPoint to work, but Cal Voices is an ACEs Aware grantee, and we are collaborating with Health Access Foundation and the California LGBTQ Health and Human Services Network to be working on this ACEs Aware project. So I will stop sharing my screen now.
All right. I have a few questions for you regarding the slide. Can you explain to people who's watching this, what is toxic stress?
So, it's really interesting. I looked through all the ACEs Aware information that they give us, and I'm like, wait, where's the definition of toxic stress? So I'm just going to give you kind of like not a highfalutin research kind of criteria, but we all have stress in our daily lives. And actually we have what's called, there's stress, and then there's something called eustress, which is actually positive stress. And even a lot of positive stress can affect you. So like, let's say you get a job, your dream job, you still will experience stress as you're starting that job. All right. There's stress when you move, even if it's something you wanted to do. But there's also stress when something happens to you that maybe isn't so positive. And most of us know that, like, if you're driving along and you get a flat tire, you're going to have stress. Chances are that stress is not going to cause lifelong problems for you. Okay.
Right.
I don't want to judge anybody, but if it's just a flat tire and you have the money to get it fixed, it'll be a rotten day, but you'll probably be fine. However, as you're growing up, especially, children are very, very vulnerable. And so when some of the adverse childhood experiences that have been identified, and also the things that we're going to talk about, particularly for LGBTQ youth, happen to them, it causes trauma. It causes a stress reaction, which they've labeled toxic stress, that can affect you for the rest of your life, especially if you get no help for it, no treatment, no intervention. And the more that it happens, the more that it affects you. And it's not like, if let's say each event is worth 10 points, for example, that it's 10 plus 10 would equal 20. No, what happens is 10 plus 10 equals 30. And then add on another event, and now you're at 40 or 50, until you get to the point where some people who have a lot of ACEs or have experienced a lot of traumatic experiences around their sexual orientation or gender identity will get to the point where they they contemplate ending their life, or they actually try to end their life. They're depressed, they're anxious, they don't picture themselves having a happy life, and it affects everything about their life. Any of you out there who have ever experienced, severe depression or anxiety or other mental illness or mental health challenges know what I mean. It makes it hard for you to just to have a flat tire. Then if you're suffering from all of this and you have the flat tire, then it's a really big deal, because you already have so much going on. And I want to say that today we're focusing on LGBTQ, but I want to point out that there's also intersectionality. So if you are also experiencing racism, and you're LGBTQ, first of all, if you're experiencing racism, you have your own set of traumatic, toxic stress. But if you're both a person of color and you're LGBT or Q, then that can be exponentially, that can be much greater stress as you go through your daily life. And you have higher and higher risks. Did that answer the question, I hope?
Oh, yeah. Yeah.
Okay.
Thank you for that.
I'm happy to add on a little bit to that too, actually. I think the important distinction that Pachi made, right, was that it's not just a one-off stressful event. Toxic stress occurs when you're in fight or flight mode over an extended period of time. And the effect that toxic stress has is that it actually changes our physiology. It causes changes in our nervous system and our body's other systems. And these can be lifelong changes to your body's physiology. This can look like physical pain or things like headaches. It can look like changes to your heart rate, blood pressure, respiratory systems, sleep disturbances, changes in appetite. I mean, it's truly amazing how many different parts of our health, our well-being, our physiology are impacted by these traumatic experiences and the way that they trigger toxic stress in our bodies. The way that they put us into those super heightened fight or flight mode, releasing stress hormones and really causing our bodies to think that we are always in danger. We are always at risk. And that really opens us up to a whole world of negative health outcomes and impacts.
Wow.
Thank you
Wow.
so much, Amanda. Can I add one more thing that because now that you were speaking about that, the other thing about toxic stress, so Amanda talked about it can make permanent lifelong changes. They found it can actually change your DNA. So that a mom who has undergone a lifetime of toxic stress, when she has children, that can be passed on. And so when you hear the terms, if you've ever heard the term like intergenerational trauma, historical trauma, this is real. And while there's a component of possibly people handing down just behavioral issues, there's actually physical bodily memory of this trauma that can affect you from the moment that you were born. So it's really important to do interventions, not just for the human being that's right in front of you, but for the future generations that it can get passed on to if it's not taken care of. And thank you so much, Amanda, for bringing that all in.
Oh, wow. That's awesome. That's good information. That's why once again, I like to talk about, I mean, I know we talked about a certain topic, but I want to get into the meat of things because that information you just shared can be very beneficial for somebody that's going to watch this show. So thank you guys for that. So what are some of the long-term health impacts of ACEs?
Yeah, so Pashi touched on this a little bit. And I think we talked about it a little bit with, talking about what toxic stress is and how it affects our body. Some of the things that folks might expect to see as a result of childhood trauma and that fight or flight reality includes things like higher prevalence of depression, anxiety, and really high prevalence of suicide attempts. Pashi pointed that out, and I just want to, underscore 38 times more likely to attempt suicide if you have 4 or more ACEs. And that compounds, as Pashi said, for each adverse childhood experience you add on top of 4, it keeps going up. So this is, we can really see that there are some very significant mental and behavioral health disparities associated with high ACEs scores. But it doesn't stop there. High ACEs scores are also associated with many of the leading causes of death and morbidity in California, as well as some of our most expensive chronic health conditions, like heart disease, which with an ACEs score of 4 or more, you are 2 times more likely to have heart disease. Same with cancer, stroke, kidney disease, diabetes. For our older adult community out there, you're 11 times more likely to have Alzheimer's if you have an ACEs score of 4 or more. We also see associations with some of the health disparities that we already experience in our LGBTQ communities: alcohol and drug abuse, HIV and other STDs. And, just really it runs the full gamut of long-term chronic conditions, health conditions, and some of those leading causes of death. So that's why, we're going to talk a little bit more about what does that screening look like and how can folks intervene. But it is, you might have a patient that comes in for diabetes and not think, maybe the underlying cause of this might be related to trauma that they experienced in childhood. But that's really what we're talking about with this ACEs work. We're seeing these childhood traumatic experiences that happen before the age of 18 can last a lifetime and can impact every single part of our health.
Wow. I want to talk a little bit more about that, because I think a lot of loved ones, whether the parents, brothers, and an uncle, they sometimes, when you have someone that identifies with the LGBTQ community, a lot of times they don't really know how to go about accepting the person for who they are because they lack education in that particular area. what would you say to loved ones who has a of someone that identify with the LGBTQ community, but they themselves lack education, don't know what to do? Like, what type of advice would you give them to try to be supportive to the loved one?
I can start. I think, I think there's a couple of things. One is, please, find that education if you feel like you want to understand more. There are great resources out there. Our community has really come a long way over the past decades, and resources like the Family Acceptance Project, like PFLAG, like GSA Network are out there. And you can learn more, and you can learn how to support your LGBTQ loved ones. And I think the other thing is, I think a lot of times family members and friends and loved ones may do things that are harmful to their LGBTQ child, to their LGBTQ sibling, loved one, out of a place of love and care. They are worried about someone's life being harder, or how the world will react to them, or how their community or the rest of the family will react to them. And so they're doing things to try to make their lives easier. They're coming from a place of love and from a good place, not knowing that some of the rejecting behaviors that they're implementing, that they are, showing to their child, is actually causing trauma, is actually can increase their likelihood of some of these chronic health conditions, can increase their suicide risk. That's not, I don't think that's what any parent wants for their child. I don't think that's what any loved one wants for their LGBTQ loved one. They want what's best, but they don't necessarily always know how to do that. And that's where that education really comes in. Affirming your loved one's identity, talking about it, accepting it, and embracing it is actually going to make a much more positive impact on their health, their well-being, their happiness. And a lot of times it's just a matter of educating parents and helping to understand, how do I do this? How do I affirm, my child's identity? What does that look like in practice? And really understanding the consequences of not doing that. Our youth need it. They're incredibly vulnerable and incredibly resilient. But we want to make sure that their families have the information, the tools, the resources to really show their child that they're loved and that they're affirmed, and that the world doesn't have to be a scary place.
Absolutely. Absolutely.
And Jesse, just so you know, I've got some slides coming up that will also add to that.
Okay.
But I will say that I think one of the things that happens is people think that this is a choice. And the reason why I say that is because if you don't think that something's a choice, like if your child was blind, you wouldn't then yell at them and tell them to try to see.
Yes.
You wouldn't say, hey, if you just would act more sightly, people wouldn't make fun of you, right? You wouldn't do that to them because you knew it wasn't their choice. And the reason why sometimes parents then do things that end up being harmful to their child is because somewhere deep down inside, they think they can change this behavior. They think they can change this, and they can't. They might make it might look on the outside like they've changed things, but all they've really done is harmed their child, and caused them to, well, I'll show you later, but caused a lot of trauma for them because it isn't something the child can actually change. It is just who they are, in the same way that their eyes are a certain color and their skin is a certain color, they're going to grow to be a certain height. There's just nothing they can do about all those things. They are who they are. And the other thing I would say is that if a family member, even an adult family member, comes out and now you're all thrown, it's just remember, this is the very same person. They have always been this way. They just haven't told you. And so
Yes,
if you loved them before they told you, there's no reason not to love them and support them and affirm them after they told you, because there's nothing actually different about them. It's just that now you know.
absolutely. Absolutely. Yeah, thank you guys both for answering this question. I'm telling you guys, this is by far, so far, one of the best shows I've done because I really want, and it's two of you guys tag teaming this particular topic, which is really good, which means we're going to get double the information. So, all right, I'll move to my next question. Why is it important to screen LGBT patients or clients for ACEs?
Yeah. I mean, I think first and foremost, we don't know what we don't ask about. You can't tell by looking at someone what their ACEs score is. If a patient comes in and they present for whatever, whether it's just a regular checkup or they're coming in for heart care, you're not going to know what their ACEs score is unless you ask them. I think also, understanding a person's history of trauma and adverse childhood experiences will help providers build trust with patients and treat the underlying causes of the issues which they present with. It's not like, you do this screening and it takes about 5 minutes, but and then you get this information, you get their ACEs score, and then you're like, awesome, that was depressing. Now I know that they had childhood trauma. Cool, I maybe just triggered them or something. No, there are evidence-based practices that providers can use, and they can use that information to help their patients. They can intervene, they can help build resilience, they can help to help their patients understand toxic stress and how that's impacting their health. And those things are going to really, can really make a difference in a patient's treatment plan. And it really, like I said, it really helps to build trust with that provider, which is the foundation of a good relationship and good, building toward good health outcomes. Additionally, you asked, about LGBTQ patients, and I would say these screenings are especially important for LGBTQ patients. We know, we do have research that shows LGBT people are nearly twice as likely to experience 4 or more ACEs. Almost 42% of LGBT people experienced 4 or more ACEs. For transgender people, those numbers are even higher. And so, these are probably leading to a lot of the significant health disparities that we see throughout LGBTQ folks' lifetimes. Those higher rates of cancer, those higher rates of substance use. It's probably not a coincidence that our communities also have higher rates of adverse childhood experiences. And just like you're not going to know if someone's LGBTQ when they walk through the door, unless you ask them, you're not going to know what their ACEs score is. And so it's really important to do those screenings. Like I said, it takes 5 minutes. You can go to acesaware.org to get training and all of the tools to do those screenings. And it's really going to help you understand your LGBTQ patients more, build that trust, and build a treatment plan that takes what you learn into account and uses it to produce better health outcomes.
Wow, excellent, excellent. What does the ACEs screening miss for LGBTQ patients or clients when it comes to childhood trauma and risk?
So I'm going to share my screen again, just because I think it's easier to hear statistics sometimes if you get to see some of them. So first of all, I want to give credit where credit is due. And Jesse, you did an amazing show with Caitlin Ryan of the Family Acceptance Project. And so that I think people can find that on YouTube. And she goes into this in even more depth. So what's important to know, and what the Family Acceptance Project is really all about, is that families have a critical impact on their LGBTQ children's health risks and well-being. So
Yes.
where this intersects with ACEs is that ACEs screenings sometimes miss the toxic stress and trauma that LGBTQ youth experience. So while what Amanda said is absolutely true, LGBTQ folks with 4 or more are more likely to have 4 or more ACEs. You can also have an LGBTQ person that walks in the door, has 0 or 1 ACEs, and yet has experienced a lot of childhood trauma. So here are some examples of the research, and this has all been documented and researched in a very similar way that the ACEs was researched, in that there are certain behaviors that parents do, and like Amanda said, often out of love, often because they're afraid for their child, either because they think it's wrong to be LGBTQ, they're afraid their family won't meet up again in the afterlife, they're afraid their child will be teased, or whatever that is they're afraid of. They want to actually help their child, but they're doing things that the child experiences in the very same way that, if you hit your child, I mean, many parents will know, well, yeah, of course I wouldn't beat up my child. And yet verbally they're beating them up without realizing it. And just some examples, and I've left this slide up so people can see it. I won't read them all, but for example, just denying that what your child is telling you. So they come out to you, they say, I think I'm gay, or I think I'm not a boy, I think I'm a girl, or whatever it is they might say to you, and you coming back with, well, how can you know? You wouldn't say that to a straight child. If a straight child said, oh, I think if you had a little girl and she's, I think, Bobby over there is really cute. You wouldn't say, well, how would you know that? You're only 8 years old. Maybe you're going to grow up to be a lesbian. You would never say that to a child you think is straight, or a child who you think, a girl saying, oh, yes, I'm a girl. You'd never say, well, you may not know that when you get older, you may think of yourself as a boy. You would never do that to them. And yet we do that to kids who tell you something that you think is not what you want them to be. So saying anything like it's just a phase, you're confused, or anything like those things is really, really damaging. Also, blaming the kid when other people don't treat them well. So if they come home from school and they've been bullied, and that bullying can happen from teachers, not just from other students, and telling them it's because of how they act or how they behave. And a lot of times this might happen to little kids who haven't actually come out, but maybe they act in ways that are maybe more feminine for boys or more masculine for girls, or they want to play with the boys when they're a girl and they want to play with the girls when they're a boy. And that may mean that they're trans, it may mean that they're gay. Who knows what that means? They could also just be straight and just enjoy those activities. But telling them, well, if you would just act more like a boy, or you would just act more like a girl, these bad things wouldn't happen to you. In any way, speaking about your child. Oh, here comes my cat who thinks that Zoom is the time for affection.
That's so all right. No worries.
Yes, affirm your cat too. But anyway, anything that you do that says something negative about who they are, it is very harmful to their mental and physical health, including taking them to a therapist or a religious leader to try and change who they are. Again, it's not a choice. And all that ends up happening to them is that it becomes a very painful experience. Do you have any questions about this, Jesse, before I move on to the more positive side of things?
No. I'm gonna try to let you guys get all this out, because I know we don't have so much time. So yeah, go ahead. Okay. You good.
All right. So there are also things that you asked, what can someone do? So I'm going to show you in a minute, of course, what kind of risk kids are under when they do experience a lot of those rejecting behaviors. But I also want you to know that it's really important that there are things that parents can do that are very helpful and that will help even if their child is getting bullied or whatever. First of all, tell your kids you love them, hug them, treat them like they really are your child is really, really important. And as Amanda said, get the good information. Go to PFLAG, go to Gender Spectrum if your kid is talking about maybe not being the gender you thought they were. Support how they express themselves. If they're a boy who wants to wear pink, if they're a girl who doesn't like flowery clothes, if it's a girl who wants to cut her hair short, or a boy who wants to grow his hair long, or any of the myriad ways that we have decided you have to be if you're a boy or a girl. And by the way, there are kids and adults who don't identify as just a boy or just a girl. That's a whole nother show. But anyway, support them in how they want to talk about themselves, express themselves. And then really important, also require that other family members treat them with respect. That's a really big deal. It's one thing if you're affirming as the mom or the dad or both or the caregiver, but if you let their brothers or sisters or uncles or grandparents treat them badly, that's also super harmful. And believe that your kid can have a happy future. This is so important. Just because they're LGBT or Q does not mean that they can't have just as happy of a life if they had ended up being straight, or what we call cisgender, meaning that they are the gender that they were born, that you thought they were when they were born. So here's some of the risks. So we talked about what happens if somebody has a lot of ACEs. Here's what happens if a kid has a lot of those rejecting behaviors in their life. If you see, there's 629% more likely to have depression if they come from a home with a lot of rejecting behaviors. Whereas if they just have a little bit of rejecting behaviors or none at all, that goes way, way down. They're much more likely. They're 8.5 times more likely, or have an 857% chance. I mean, I can't wrap myself around that number, of attempting suicide over their lifetime if they come from a highly rejecting home over someone who just comes from a low rejecting home. And I want to be really clear. We're talking about behaviors here. While it would be lovely if parents were excited and celebrated that their child is LGBT or Q in the same way that they might be excited or celebrate that they've learned how to play the piano or whatever, I do understand that for some parents, this is really difficult. So what we're talking about now is not how you believe, but how you act. And that how you act can change these horrible statistics. Again, higher rates of illegal drug use and higher rates of HIV infection. And that's because of the risks that kids will take because they have these really negative views of who they are because of how their parents may have or caregivers have treated them. And then again, this is just another illustration of the more family rejection, the increased risks for serious health concerns, including depression, suicidal thoughts, attempts, drug use, and STD risk. And if you see on the far end, if you have no or low rejecting behaviors, you're not nearly at risk as a risk. But okay, and I think that's the end of the slideshow. Okay, so let me stop sharing. And there you go. All right. So I said a whole lot there, but the most important thing, and this is something that as we became involved with the ACEs Aware project, became really apparent to myself and to Amanda and other people who do this work, is that those rejecting behaviors, for example, telling your kid they can't go to an LGBTQ event, telling your kid they can't have LGBTQ friends over. If they tell somebody, if somebody's doing an ACEs screening and they say to that kid, gee, do your parents, verbally abuse you or whatever the question is, or however they frame it, those kinds of behaviors, providers don't see that as abusive. Providers don't see a lot of the things that LGBTQ youth experience as really traumatic, as abusive, because we still live in a society where that's all acceptable behavior. Mm-hmm. And so that's how it gets missed by ACEs. It is emotional abuse, but it's not asked about in a way that those things are going to rise to the surface. And so that's that's our biggest concern, is that people get missed. And like I said, they can wind up with an ACEs score of 0 or 1 and still be coming in with diabetes and heart problems and depression and all these other, and suicide attempts. And no one stops to think, oh, wait a minute, we need to intervene here with this traumatic response. And it starts in childhood. It gets worse as they get older. I think Amanda's going to talk a little bit about what can happen to kids, especially during COVID. So we have the tools before us, and the Family Acceptance Project has developed tools. There's trauma-informed care that all can help alleviate this toxic stress that all of these things cause, even though the ACEs screening might not reveal them. So that's, I think, the most important message of what I'm trying to say with these slides. And Amanda, do you want to add anything so far? Or Jesse, do you have any questions?
No, I'm okay.
The only thing I want to add is, for any parents who are watching, even if you don't know or don't think that you have an LGBTQ child, these behaviors can be incredibly harmful to straight or cisgender children as well, and to a kid who maybe hasn't come out to you yet. I didn't come out when I was a child, but hearing negative things about LGBTQ people when I was young definitely impacted my self-esteem. And your kid, may not come out until later in life, but those things that you're saying could be impacting them now. And it could make them less likely to want to talk to you, not just about that, but about some of these other risk behaviors that Pashi mentioned. And I just really want to encourage any parents who are watching to, not just take this to heart if you know that your child has come out to you about being LGBTQ, but really think about how the things that you're saying about LGBTQ people could be impacting a kid who hasn't come out to you yet, or maybe one of their friends who's over at your house, or loved ones that are in your life.
Absolutely.
Yeah, I want to add to that. Thank you so much, Amanda. And I'll just use myself as an example. I realize that youth today do have more access to information than maybe I did, but there were many things that my parents said and did that made me understand somehow, very, very deeply that being gay was not an option. Wow. And I, to the point where I didn't even let myself think of myself as gay. And so you just don't know, as Amanda said. And I'll use two of my brothers as an example. Both of I have a little brother who at 2 years old was playing with high-heeled shoes because his sister had high-heeled shoes. And my dad was so concerned and afraid that this would make his kid gay that he made him take those off. My little brother is not gay, not that there would be anything wrong with that, but that was very traumatizing and sent very distinct messages about what masculinity is and whether or not he was truly masculine. And that can affect you whether or not you're transgender, whether or not you are gay, as Amanda said. So it's really important that we examine our own biases when it comes to what does it mean to be a girl, what does it mean to be a boy, and what we might be telling our children and what we might be creating for them.
Absolutely. Absolutely. I have a friend of mine, I'm obviously not going to mention names. He communicates to me maybe like 3 months ago that his sister came out as an adult. Family was not trying to hear it. They wasn't for it. And she moved to a whole nother state. They have not spoke to her ever since she came out. I encourage him to reach out to her, to talk with her, because he doesn't feel the way his family feel, but she thinks that. He's tried to reach out to her through Facebook, Instagram, and there was no response. And I just told her, just give her a little time, because she's still trying to figure things out because of the way that your family responded. You didn't get a chance to, talk to her and everything. He heard it, like the information secondhand. So after that, she just left. And it really bothers him that because he feel like, she feels that she doesn't have any support from the family. What she does from him, but she doesn't know it yet, you know. So that's, to me, I'm telling y'all, this particular show in general, I'm definitely gonna make sure I got a group of people I think need to see this. Just people who, 'cause I think it'll really raise a lot of awareness and education to them. So that's why I'm excited. So I'm gonna let you guys get the next question. We're gonna have like 5 minutes left, but I'm trying to run through this. All right. Has COVID had an effect on the LGBTQ youth? Amanda.
Yes. Next question. No, I know we're trying to move along, but I mean, just, the last year and a half has been incredibly challenging for LGBTQ youth, as it's been for probably most of us. Many LGBTQ youth have lost access to their support networks, maybe a school GSA club or a local LGBTQ center. And those support networks were the things that were, would make it easier to navigate the trauma of the pandemic. For myself at the network, we work with a lot of LGBTQ serving organizations throughout the state. And one of the things that we've heard repeatedly is that they've lost track of the LGBTQ youth who use their services. They haven't been able to get them to come to their support groups, or they're not, picking up their phone. And the concerning thing is that they may be at home with a family that rejects them. They may be exposed to more trauma.
Yes.
They might not have a private area, private space in their home where they can really be who they are and, access those services that would help them to cope with and navigate the trauma of this pandemic in this last year and a half. And let's be honest, the trauma of being a teenager, or a preteen. We've seen the statistics about the higher rates of intimate partner violence, the higher rates of calls to Trans Lifeline and other crisis lines, all of the risks that we've seen. It's important to remember these are compounded for our LGBTQ youth. It's been a tough year and a half. So, this work is more important than ever.
And I'll just add something really quick. I know we're running out of time, but I want to say that one of the unique things that has happened to our youth is that kids who went off to college, which is the time oftentimes when kids come out, if they weren't able to come out at home, and they're finally able to get support and feel free. And with the pandemic, as you know, many of those kids were sent right back home.
Yes.
And so they were sent back into a traumatic environment where they often didn't have access to online resources because they don't have privacy, or because of maybe they don't have the equipment or the bandwidth or whatever it is. And so now they're back home in this toxic stress environment for them because nothing changed for them, but they had that taste of freedom, and it makes it even more traumatic than to have that taken away.
Yes, absolutely. I really do hope the family members, I really want the family members to really grasp a hold of the information that is shared here today, because like you said, Amanda, sometimes things happen because the parent loved the loved one, but they really don't know that they are actually harming them. And that's so important. And that's literally what I was thinking about with my friend's sister. Like, wow, I do, because the family, they're like extremely close, but they just don't know how to deal with her life decisions because of their lack of education. That is definitely, and I actually told him yesterday, I was telling him I was doing the show, and so he was like really excited. And he said, well, I can get a copy of it so I can show, my mom and dad. I said, absolutely. I'm gonna make sure you get a copy of it, because I think it's important. And I know it's gonna bring some form of enlightenment to this particular family. So I'm gonna ask one more question before we go. How can providers learn how to screen for these rejecting behaviors?
So I'm going to answer a couple of questions, one that I know you didn't even ask me yet.
Okay.
Because I know we're running out of time, but basically one of the best ways to learn how to do this is to do it through the Family Acceptance Project. One of my dreams, if I could wave my magic wand, what I'd really love is to have money put into the budget to allow the ACEs Aware initiative to provide trainings to providers just specifically on LGBTQ youth, how to screen for the rejecting behaviors, how to refer for proper services. What are the things that we can do to bring parents and youth back together again? Because that's just so important. And so that's really how they can learn right now is to go to the Family Acceptance Project. Just Google that and the website will come up, and I gave you the website, or rewind your YouTube and the website is on one of the slides. And I just want to say quickly for your friend or for anyone else out there who's in the same position as your friend, one of the things as a family member you can do to support is to first of all stand up when you see something being said, because you never know who's listening, right?
Yeah.
And if they see you as someone supportive, even though they never tell you, it makes a difference. But also, like you said, educating, working towards that reunion, and to remind that family that, again, no one chooses to lose their family because they're gay. I mean, they don't choose to be gay so that then they can lose their family. That is not what they do. So it's really important to understand that how the family is reacting. They're the ones that are choosing.
Right.
The only choice that this person made, or any person who comes out, is to choose to finally say who they are, but they don't choose who they are.
Right. Exactly. Okay. Well, thank you so much, both. Thank you both. I'm sorry, Pashi and Amanda, for taking the time out to just raise awareness on this particular topic, and continue to do the good work you're doing. I hope that we can do another show in the future, because like I said, this type of work is definitely needed, especially through the media. So we have run out of time. And thank you for this edition of Mental Health Matters. If you like this particular show, if you would like a DVD copy of this show, or if you'd like to be a guest on our show, please dial 916-366-4600. Thank you.